Out of all the topics that you've discussed on your podcast, what has gone the most viral and why do you think it did?
You know what's so crazy?
Wait.
Lancome's been around for like ages.
I feel like they know their stuff when it comes to skincare.
Totally, 100%.
Michael has a dot on his face that we have been talking about for the last year every single morning. It's an actual dot.
It's not a, well, you can't see
it's
it
a piece
right
of
now.
pepper.
It started out
Yeah.
as like my son scratching me in the face.
Okay.
Young son. We have a young son.
Got it.
He's
Got it.
25 years old.
So
No,
it
just
was
kidding. He's
an accident. Yeah, exactly.
It was an accident. And then it was like struggling to heal. And then I wasn't thinking much about it. And then it did heal. And it keeps like healing, but then opening. And
I don't like that.
I went to a derm and they said it's a blood vessel
Okay.
that I forget the exact
The
word
audience
for
just
it.
tuned out.
It's probably a hemangioma. Let's take a look.
Okay, it's right here.
Can you come to me or should I come to you?
I will come.
Go
I
look
will
at
come
the
to
dot
you.
on air.
But anyways, I don't really notice it other than like sometimes it'll get red. And again, like
I notice it every day because he talks about it every day.
I get red. That's just like
Sure.
my thing.
Rosacea tendencies. Yeah, maybe.
Yeah, and I notice it sometimes if I put like a vitamin C, I'd be like, oh, there's a little sting. But then I
Okay.
go get skincare so regularly that they're like, yeah, the thing's healed. Like, calm down, buddy. But I'm just
Got
neurotic.
it. Let's take a look. Get on over here.
It's not like a.
Real life consult
You know, it's
by a
gonna-
dermatologist.
It's gonna make me
Michael,
sound crazy
Let's
because
just go show her the dot so we can move it along.
I'm moving along. Can I swing my mic over?
No, Michael, we don't need your mic. Just we don't need a narration.
So really as a dermatologist, oh, okay, yeah. So really I need my light, I need my dermatoscope.
Okay.
So when I press on it, it blanches, which means it goes away. And that means that it is a blood vessel. It probably is from trauma. You have a little rosacea. Did you know that? Yeah. So I'm not worried about it. It never opens up or bleeds, right? Great. So I don't think it's a skin cancer. It probably is a little hemangioma. We all have little broken blood vessels around our noses. Yeah. So we could just laser it off.
But okay.
I'm not worried. You have a name for it. It's called a hemangioma.
No wonder I can never remember it because I was trying to explain to Lauren. I just call it a blood vessel.
Yeah.
But I was going because I went down the.
I gotta change the subject.
Hold on,
Move
let's-
it on, Michael.
No, I went down the rabbit hole. This is relevant to our listeners and viewers.
The rabbit
And I was
dot.
like, oh my God, I have a wound. It won't close. I've
Yeah.
got skin. Because people have to watch for that. And so then I was like freaking out. But then I went and, what's it, a hemangioma? Yeah.
Hemangioma. Yeah.
Hemangioma.
Which let's talk about what you can do for that. And that's going to be how to improve your skin barrier, how to do all that because you probably have really
Thank you
sensitive
for
skin.
that
Okay.
transition.
But
please.
I went to a derm here.
Hey, Michael.
Hold
no.
on, real quick, Lauren.
I know some good derms here, too.
Here, and he said the same thing, but I just want the thing to like close. And then I was wondering,
For
can
sure.
I get it burned off and then it'll
Totally.
just like go away and be done?
Yeah. You want it lasered off.
Okay.
I got you.
What can people do for their?
Am I going back to Tucson?
I'll see you in Tucson where you used to live, which is crazy.
I'm ready to. I'll make a trip out to Tucson to see you. We can.
Okay, perfect.
can burn
Or
this
have an
thing
office
off.
in Beverly Hills.
Beverly Hills. Let's go back to Tucson.
Okay.
What can people do to support their skin barrier? Michael's taking notes.
I love that question. You know, that is going to be the theme for 2025. Now we're wrapping up the year. We always think about what is going to be the new thing. What is everyone focusing on? And I think that skin barrier is like so important, especially because people are getting introduced to more ingredients. They're using more products, right?
Than ever.
Yeah. And, you know, not that I'm like totally against like a 10-step skincare routine, but I really do think people need to be careful. But I think that for skin barrier, what you want to do is first minimize it, minimize the products you're using, use skin-loving ingredients, right? So with like a skin barrier, everyone wants like a healthy skin barrier, right? It doesn't mean that you have eczema or rosacea. Those people need it the most. Those people have to be really careful about exfoliants that they're using. They have to be really careful about different like retinols that they're using,
Oh, great. I'm
things
using
like
all
that.
of these things.
No, he's using Alpha-Ret. She'll be happy about that.
Oh, I
think.
love that.
I
Okay.
knew it.
Yeah,
See?
yeah.
Okay.
Love that.
I don't lead you wrong, bitch.
Yeah. Love that. So how do we improve the skin barrier? You have to use products that are really good for your skin type. You knowing that you have really like a rosacea sensitive skin type, which is why you're on a product that is with peptides and a very mild retinol, right? And then you want to moisturize and you want to add in some of those ingredients that improve your skin barrier, like ceramides or different oils or humectants that pull in water. And we can talk about some of these ingredients and even some of the products that I recommend for that, because I think 2025 is like the year of like kind of like new skincare in a way. Everyone's looking at Lindsay Lohan, right? And it's really funny because I actually know her derm. Not like she's in LA and she is a huge like laser queen. And I really think that like Lindsay Lohan, I don't think she got a lot done. I don't think she got like a whole bunch of plastic surgery. She has really nice features, but I think she got healthy. I think she reversed some of the filler in her face, right? And then I think she really went in hard with like good skincare and good lasers.
Wait.
I really do. I really
You don't
do.
think she got a mini lower
Like
facelift and a neck lift?
Maybe
A little one.
a little, maybe
A little,
baby, little baby, and only because she had a baby, she did lose a little bit of weight. When you do have some laxity there, but lasers can do a lot these days. Also,
I totally agree. There's a little happening.
Yeah.
But yes, she has focused on good skincare. I would agree with you. And people are missing that element when they say she's gotten work done. You can get work done, but if you don't have a good, healthy skin barrier, I agree with you. But there is a
little nip and tuck, maybe. But I think
love it for her.
People, yeah. Oh my gosh,
Go for
amazing. But I think she's done tons of lasers to resurface that skin because she's probably done tons of like tanning bed, But everyone wants that one answer, and it's like she did a lot. That was not one thing.
It's a commitment.
Totally, 100%. And I think people, instead of like going straight to the facelift, it's like, let's look at her skin quality. Let's look at her like filler reversal. I think she does still have filler, but like done correctly. And like, it's really undetectable, you know?
That's what I think everyone in this moment wants. If anyone who's going to get work done is undetectable work. I think that's what the goal is. I think it was like so far, people like took it so far with the cheeks and the lips. Totally. And it actually ends up working against you where you look older subconsciously because it looks like you need a lot of work done. So I mean, personally, I just like a little filler in the lips. I think that's enough. I think if you go too hard, you're almost setting yourself up for a disaster if you ever want to get a facelift.
Totally. And also, things have trade-offs, right? So when I have a patient who's like, oh, I just want like a little, like we always go like this. My patients always go like this and pull up their cheeks. And it's like, okay, we can add like, sometimes I'll just take 1 or 2 syringes and like do a little bit everywhere just for like how the light goes off of the skin. It's like how everything kind of looks, the contour, the highlights, things like that, reflects off the skin. And I don't think people need much, but you're right. If you want like super high cheekbones, what about your temples? What about your mid cheek? Things like that. Like I have filler. It's like my job. I do think it got villainized because everyone went too crazy with it. And it was like this thing called perception drift where you forget what you look like. Your provider's not, maybe you're not going to the same provider, or maybe they're not looking back at the photos, but I like have to cut people off sometimes, not in a bad way. It's just like, hey, we are where we need to be. Everything's balanced. Everything's looking good. So I totally agree. I also don't think that fillers or Sculptra or all these other things are like ruining your face so much where you can't get a facelift. I think that's a little fear mongering from some plastic surgeons. But in any case, you got to do it right. You got to be conservative, like you said, and some things are fine to do.
I think the biggest win, in my opinion, with any work is it's harmonious.
Yes.
I think it's like in alignment. Because even if you go and you spend all your money on like getting the perfect lips, it throws something else off if you're not careful. And I've talked to a lot of people about this. Like they'll get their nose done and then they're like, wait, I need my chin done too. And they never notice their chin because they changed their nose. So it takes the harmony out of it.
100%.
I think my word, if I was going to get into like plastic surgery all over my face, would be harmony.
Yeah. No, I think you're spot on. And a lot of us kind of say that too. It's like facial optimization, facial balance. Yeah. I think harmony is like such a great, because it has to go, you have to look at their ethnicity, you have to look at their eye shape. Yes. Like me personally, I cannot have huge lips. I have like massive eyes. Like it would just look really odd. And I can do it on myself. Anyone can do it on me. It's just like, you gotta find yourself a good provider, find yourself a good derm, trust in them. Find someone who you vibe with, and let them be your like person. But don't be afraid to ask questions too. And like, I don't know, if someone's just saying yes, I think that's a red flag.
We've kind of been talking about a lot of things besides me for a while now.
Oh. I'm teaching you how to be in harmony.
I'm just kidding.
You gonna change it back to yourself?
No. But I was going to ask, when people come to you at this point of your career, are they mostly coming for aesthetics, or are they coming because of problems and issues with the skin, or is it a combination?
That's a really good question. So I am highly like specialized, and like I'm a freak of nature, I feel like. So I'm a board certified dermatologist. So that's like after med school, it's like 4 years of derm, or 1 year of medicine and 3 years of derm. So I do have a half a day of clinic where I do like skin checks. Okay. That's not like my main thing. I did like extra training, and I'm a Mohs micrographic.
And how crazy should people be? No, I don't want to say crazy. How often should people be doing that?
The skin checks?
The skin checks.
I think once you turn like 30, you should do it once a year. And if you have insurance, it's covered by insurance. It's not a cosmetic thing.
The full body one where
people
you go
need to know that. Yeah. And like treating rosacea, treating eczema, treating hair loss. Some of those treatments for hair loss are not covered by insurance, but like oral minoxidil, things like that are covered through insurance. Use your insurance.
When you're doing a skin check, is it like spreading everything? Like what's a skin check entail?
This guy was in there.
I love this.
He was up your ass.
People get really nervous about this. So we usually say, I put people in a gown, and I say bras off, just your underwear on. If they want to keep their bra on, they can. And usually, I see men and women. So I keep things pretty, I look at their arms first so they're comfortable, and then I look at their face, and then I look at their scalp, by their ears. I have them stand up. I look at their back and bottom. I ask them if there's anything on their bottom they want me to look at. If they have a lot of moles, I kind of just say, can I look at your bottom? There are some people that come in like butt ass naked. I'm not gonna lie.
I would go butt naked.
I went full in.
Yeah.
So I usually ask. We might as well.
Yeah,
get
I asked.
Your dick was.
I was like, listen, we're here. We might as well.
Did you check your balls?
He got it. We got in there.
You can't, and I do too. I ask. Like sometimes guys come in.
I mean, what if you miss something there?
Exactly. So there's less things there. But I usually, if they have a lot of moles, I say it's usually recommended. Or if they come in for a spot, or sometimes I have to ask, like, hey, is there anything else you want me to look at? You want me to look at your groin area? And then they'll say yes or no. There's like skin tags they want me to remove.
The guys are like, grab onto those guys.
Yeah. So
what?
The guys are probably like, yeah, I want you to look at it all.
I had a man looking at me.
You know what's crazy? My main office is in Tucson. We have U of A there. And the amount of like frat daddies.
Oh, I'm sure.
Or frat guys that I've had come in, just be like, is this normal? Is this okay? Is this an STD? Come in is insane. And it's good. It's good they do that. But I don't know if they know it's me looking at it. I don't know if they
Is there
Google
a lot of STDs?
Yeah. There's a lot of, no, I mean, not that many, but there are a lot of genital warts.
Oh.
Yeah.
What do you do for genital warts? This is a little tangent-y question.
I know. So I've had to cut some out because they were malignant.
Oh, you have to cut a wart out.
Not a wart. So if they just have little warts, I'll freeze them. If they have more than one or one's growing, I'll biopsy it and strain it and have them check the HPV strains to see if it's like a bad strain or a benign strain. And I would say in like a handful of people, one guy I sent, it was on his penis. I sent him to a colleague of mine to do the surgery. And then a few other people, I just do the surgery on their penis. This is really.
I don't.
I'm a skin cancer surgeon.
Wait, hold on. I don't ask this to make fun of it. I ask it because I want to take the tabooness out of STDs.
100%.
I remember when I was growing up, having an STD was like, oh my! It was like a scarlet letter. So I just am trying to like. People have had STDs.
Back in your day, they sent you off to live on the side of a hill for the rest of your life.
No, and I am making light of it, but it's definitely not. And my biggest thing is to make patients feel as comfortable. If they don't want me to operate on them, I'll send it to a male colleague.
Yeah.
But I have done it several times on people even in their 30s, 40s. I wouldn't say this is common, so I don't want everyone listening like get freaked out or get their partner like freaked out. But I will say genital warts can be common. They usually need to be frozen, but if they keep coming, there's a lot of them. Maybe one little biopsy is not a bad idea just to see if you have like HPV, the bad strains, just like women.
I think it's good to talk
Well,
about.
100%.
Listen,
What I was mostly getting to with the initial question is, at this stage in your career, are people now more focused on the aesthetics, or are people going to see derms for health? And the follow-up is, are we maybe getting so focused on some of the aesthetics and skincare that we're neglecting some of the health that is required to make sure that we are keeping our skin safe?
That is a great question. Okay, so in my practice, we do medical, surgical, cosmetic, everything. And then I also do integrative. Your dermatologist should be offering medical skin checks, right? If they're not, someone in their office will be, right? For people that are like more specialized, so I did a fellowship in cosmetics and skin cancer surgery. So for me, I do less skin exams than some of the surgeries and things like that. But I would say that it's just as important. And I've found so many patients where I've done Botox on them. I saw their kids for acne, where I diagnosed a melanoma on their mom, or they came in for Botox. I'm like, let's do your skin check. There's been plenty of times where I've found a skin cancer. So I think that as a physician, it's like, do no harm
And if you
first.
find it early enough, is it, again, this is based on a place of ignorance.
For sure.
If you say you catch it in the very earliest stages, like how big of a deal is it compared to if you wait too long? Because I think being proactive about these things is important.
Yeah, 100%. So there's melanoma. That one is the one that can spread and kill you. A little bit more scary. I've seen a lot more melanomas lately, I would say. That one is where if you don't catch it 6 months or a year, it really kind of just depends. That one is the one that can kind of spread. So I would say get your yearly checks. Your family history is so important. Tanning bed history is so important. And the number of moles you have is really important. After the age of 30, you really shouldn't see any new dark moles. So anyone who hears that is like your red flag. That is like your little guidance to go see a dermatologist. And then I'll tell patients like, hey, you're pretty low risk, you don't need to come in. Or someone else, I would be like, let's check you again in 6 months.
What profiles someone as low risk?
Low risk would be no family history, not a lot of blistering sunburns, no tanning bed history, and less moles. Like people who have more moles have a higher risk of developing melanoma. There's just like a chance that your body will mess up.
And when you say tanning bed history, is this for a prolonged period of time, or you've gone in once or twice?
Yeah, great question. There is some data to support like even one tanning bed use can increase your risk. I forget what that number is, but fine. We all like did it for prom, whatever. Like you probably did it. But
Wait,
I would
did you
say
do it?
prolonged.
have you gone in a tanning bed?
I've gone in a tanning bed.
How many times?
Maybe, honestly, swear to God, maybe 2 to 3 times maximum.
Okay, so that means 10.
No. Nice. I've just said that maximum in Tucson.
So you're like would be like a
tell me.
little.
Wow.
I would ask you that, and then I would like have a lower threshold to check things. So that's melanoma, right? And then we have
some of that spring break body, you know what I mean?
Yeah.
Back in the
And
day.
then we have some of the dorms at U of A. I don't know if they still do, but they had tanning beds. And then we have non-melanoma skin cancers, right? These are the most common ones. These are not as scary. They're not typically going to spread and kill you. These are the ones that I diagnose in like 30-year-olds. And then 60 plus, they really have them. So basal cell would be something like if you have a pimple that's healing. So I didn't like that you were like that spot is healing and then coming back and healing. That is a kind of a red flag. I looked at it, looks fine. But if you feel like a pimple's like showing up and then like healing on its own and something's been there for about 3 months, that's when you should go and check it, because skin cancer doesn't always need to hurt. They don't always have to bleed. And they're really slow growing and they look like they kind of heal on their own. And then you have squamous cell, which is this other type of non-melanoma skin cancer. And these are usually a little bit more scaly. So if you have a little scaly patch that's not going away, that is also a time to get it checked out by your derm.
What about perioral dermatitis?
Yeah, this is a big one.
A lot of people have experienced this. I've been talking just in my community and I've heard this a lot and I've had it before.
Yeah, I have so many patients with this. So perioral dermatitis is the cousin of rosacea. So they have very similar triggers: travel, like irritating skincare, diet, which can be anything inflammatory, and that's so different for every person. I usually see this flare up with my patients that are traveling somewhere and using a new product.
I shaved my face, which I do all the time.
Yeah, dermaplaning.
Totally fine.
Yeah.
But then I made a mistake and I got a peel.
Okay. Yeah.
And woo!
baby. Yeah.
That was bad.
Yeah. So, yes. So it comes and goes. There's no cure for it. There are things that you can do to improve your skin barrier. I think if you do have like a little bit of flare, sometimes it can be red. We call it perioral dermatitis. Dermatitis means rash. Perioral means like around the mouth, but it's usually kind of like around the nose too. So with anything like this, you kind of know what triggers it. People kind of know what triggers it. So I say stop any of your actives for like 2 weeks. Even like toothpaste, the fluoride in toothpaste can
cinnamon.
Totally. Yeah, exactly.
The fluoride.
The fluoride, cinnamon, and then the triggers that can make it worse that are similar to rosacea include vasodilators like alcohol. It can include, cinnamon is an irritant for sure. Chocolate, hot teas. What else? Anything that's like really fun and amazing, like heat, sauna, high emotions, things like that. But perioral derm is like really irritating, and it can really irritate people. When it gets really bad, I honestly prescribe a whole bunch of stuff just to keep it at bay, so then their skin can heal and then they can just do their normal life. But they sometimes just need some prescription to keep on hand because sometimes it gets really bad and raging.
Out of all the topics that you've discussed on your podcast and your Instagram and TikTok, what has gone the most viral and why do you think it did?
You know what's so crazy? Nail stuff. Yeah.
What
I
about
don't
it?
know if it's because people don't talk about nail health or gel manicures or if they're safe. But every time I talk about nails, and it's not that many times, but the videos always go kind of crazy. And it's like has a lot of discussion in the comment section. I think it's just derms don't talk about it enough. Everyone talks about skincare and hair. Hair is another topic that's really important. But yeah, that is like a big one. And then also I do a lot of, I'm a skin cancer surgeon and cosmetic surgeon, but I also did this year of like integrative derm, which I think you would actually love. You guys would both love because it's like, what can you do with your diet? What can you do with supplements? What can you do with like some of these alternative things in your life to help some of these common skin concerns? Because Tucson is a little bit of woo-woo, is like a little woo-woo, you know? We have like Miraval there, which
It's
I know we have
earthy.
here. It's earthy. And some of my patients don't want traditional treatments for acne. So I go through like a list of other things that they could try first, like supplements.
What? Give us some examples.
Well, for acne, for acne, for example, supplements are really important. So prebiotics, probiotics. Sometimes I run a panel with that. Diet is super important, right? So we talk about whey protein, if they're on that.
Good or bad way? Good, like,
bad.
Bad for skin.
Yeah, it is bad. Not that whey protein's like so bad for everyone.
Just if you're trying to heal acne or
if you have acne
skin.
breakouts, especially in men, like if they have back acne, whey protein is usually something where I'm like, hey, you gotta go with pre-protein.
What about like little bumps on your arms? Is it going to make it worse?
So that is like a type of eczema. The little bumps on your arms it's called keratosis pilaris. Yes.
And what makes that worse?
An impaired skin barrier. So basically what those little bumps are, they're like little dead skin cells getting stuck in the hair follicle. So you got to moisturize. If you live in the desert, you got to add a humidifier to your bedroom and you want to exfoliate. I'm not a huge fan of physical exfoliation because it can end up being just red and we have to laser it. But I love chemical exfoliants like lactic acid, glycolic acid. Urea is so nice because it's a humectant, which means it moisturizes, but then also exfoliates. So there's a whole bunch of like cheaper over-the-counter stuff for KP as well.
Any foods that you would say to avoid or eat more of?
For like an eczema type, I have to kind of go through it with the patient and see like what they eat. I know when a patient has eczema when they're really tiny, food is more of an issue. When they get older, food is not a huge flare up for things like eczema. But I always say, keep it like anti-inflammatory.
Right. That makes sense.
Like always, like with anything. And this is where I really like some of the supplements. This is where I really like some of the infrared saunas. We have a red light panel that I really love. And so There's like, it's just like, it makes sense, right? Your lifestyle and your body and your skin, they're all like super related.
How do you feel about red light therapy? We use a light stem bed. Do you like red light therapy for the skin?
Yeah.
And if so, how often and like what application?
Yeah. Red light actually has a whole bunch of studies to support it, both for the body. And I have like a huge red light panel in my office too for patients. So it stimulates collagen, decreases inflammation, increases that circulation to that area, which is what you need. And just overall, that's a really good thing. And then for hair, we know it stimulates hair loss. We know it stimulates hair regrowth and helps decrease hair loss. So, of course, this doesn't replace hair treatments, but I think it's a nice addition. And then just, I think the placebo, not even the placebo effect, but you just being in that like red. You said it's like a big light stem thing, so it's like a whole body thing.
Yeah, it's like a whole body thing. But
That's amazing.
I'm sure you've seen like the face panels and the body
Yeah,
panels.
for sure. I mean, people. That's the same thing as like the masks.
Yeah.
I don't think they replace skincare, but it's not completely nothing. Yeah.
What about nails? You mentioned nails earlier. What are some things that people have freaked out about with nails? You got to tell us the videos.
Okay, well, so the UV or the LED lights, right? So for the gel.
Oh,
I know.
Just did it the other day.
Yeah, mine are too.
I wear driving gloves, but that's
I just sent a video. You're so funny. Like I'm not the target, but my sister.
Yeah.
She gets these all the time, and I sent her a video. I'm like, hey, this looks a little dicey.
Well,
with, like,
his sister has like crocodile claws.
Oh no, because of like so much sun damage.
No, like her.
Like she gets the long
like
nails.
she gets the nails that are like a crocodile dew claw.
I see. Okay.
Not her hands are.
So, I'm like, oh my God, I don't know.
Crocodile skin though is a great term. We want to avoid crocodile skin.
We don't want
like
that.
they get the long ass
The
nails.
talons.
Yeah, I know what you mean. I know what you mean.
By the
she
way,
must like that's a lot of maintenance. She's probably there every 3 weeks.
Well, that's why I said it. I was like, yeah, I don't think this looks. Maybe you can speak to it better than me. I just literally forward a video online that I see and say, hey, be careful.
So are the gel things you put your hands in horrible?
So the traditional UV lamps are but the thing is, the newer lamps that are LED, that's still UV, but a very specific wavelength. In a very short amount of time.
What's the brand? Do you know the brand? I want to buy it.
Yeah, I mean, they're also a sponsor of my
love.
I love them.
Out.
So really, and you will see a difference. Like at C&D shellac, if you go to a C&D specialist that's like a professional, you are putting your fingernails in that little thing for like no more than 10 to 15 seconds. Tell me who that you've gone to leaves it only in there for 10 to 15 seconds.
It's like
no
2
one.
minutes.
It's like a minute and a half.
Yeah.
And it like burns, right?
Yeah. Like,
that is not right. That is not right. And also people should not. So this is like a really big thing for me. Like gel shouldn't be like thinning out your nails, but them drilling it off is absolutely messing up your nails. They should not be drilling off the gel. Like with something like shellac, they soak it in acetone, literally just like pops off. They just like pull it off.
Well,
can I ask you a question?
I like a Russian manicure, which has changed my nail health because because they don't drill it off like that. They're so about the integrity of the nail.
Yeah.
I just need to get you have to tell me what the brand of the thing is. Everyone's going to ask, what's the brand of the
it's like C&D. It's shellac.
It's literally C&D.
Literally.
Okay,
yeah.
so hold on, Michael. I'm sorry, we need to know about this.
I need to ask.
What's it called? It's like a bed for your nails. It's the light.
The LED light.
Okay, so it's C&D. That's the brand.
Yeah, that's the brand. It's if you want a light to do whatever a gel at home, you want to make sure it's LED.
Got it.
LED versus the traditional UV lamps. LED may have a little bit of UV in there, but it's not more than just like you walking to your mailbox.
Got it.
And of course, wear a little bit of SPF, wear your gloves. That's going to help like your hands, right?
Okay.
So
Michael's acting like he's never had a pedicure before, which
I was going to ask a question, but now I'm like kind of debating.
Go ahead.
Usually
No, do
I don't
it.
get hesitant to be.
Do it.
No, and then I was like, do I do this? And they're going to get.
Go ahead.
I'm trying to wonder when it comes to these long dew claw nails that these girls are doing.
Okay.
Who are they doing that for?
Themselves. They want to look hot.
Yeah.
But look
Hold
hot
on.
to
Who are you doing your hair for?
Well, no, okay, but I'm wondering, Carson.
Who are you getting your salmon semen facial for? He gets salmon semen facials.
Oh, that's going to be, we'll talk about that.
I understand having bright, youthful, glowing skin to be an indication of hotness for everybody, right? Everyone wants to have nice dewy skin.
So they want pretty nails.
No, but the long, like, do they think that men find those long nails exciting?
Some men do like them, and men.
Carson, do you?
Okay, some men do like them.
Yeah.
But I'm always wondering what the hell are you getting stuck under those nails?
They're doing things for themselves. There's this thing about, and I like just get my nails done for really like podcasts.
What are you doing when you got to wipe?
It makes you feel more put together.
Well, for me, I like a short square nail because
hold on. Answer me this. You guys have, this is too much.
We both don't have long nails, so we can't.
If you have these long ass nails and you got to wipe, what is happening underneath those nails?
I think that there's a lot of bacteria going on.
I can't get past that.
However, I think that everyone should be able to express themselves with their nails how they want. For me, I personally think that it's the chicest to have a short square nail.
There's actually a reel on that of like someone demonstrating how they wipe. So you can really,
I can't get past.
You can search it if you want.
I don't know if I can get past
this is probably what they do. I'm gonna guess. They probably wrap their nails in toilet paper. This is what they do. I'm going to already tell you. I just know. They wrap their nails in toilet paper and then they take a big ball and then they go back there and they wipe, which is like a condom for your nails while you're wiping. I don't think it's that weird.
How exciting wow.
Well, what do you do? How do you wipe?
I don't have long ass claws that I need to worry about that with.
You have hairy knuckles.
My knuckles, you think I'm wiping with my knuckles? No, I go in like a normal person and I assume it's someone with normal nail length.
Oh, okay.
Anyways, but I just wonder about this thing because I was like, oh, like, I guess people think that this is exciting and attractive, but I'm like, is this for other women or is it for the men? Because
I think it's for them.
I'm just saying, I never sat around in a group of my men and be like, man, did you see that girl's long ass nails?
I hope everyone who has long nails on social media eats him alive, but I do want to know how you type.
How do you like play, like, what do you?
They probably voice note. That's what I would do.
I see these girls sometimes and they have their phone and they're clicking like this, almost like they can't use it normally. Anyways.
Honestly, I think they learn. It's a whole new skill.
Yeah.
I hope that we don't have a lot of listeners or viewers with those long nails.
Oh, they're going to tear you a new one for
There's
sure.
so many listeners
I feel
with
like our listeners don't have those nails. Like when I picture our listeners, they don't have the nails.
No, I don't think so. I think it's honestly in to get like shorter nails.
Yeah,
less is more now. Right?
I don't mean to brag, but I've always loved short nails. I think it's so chic.
The ladies that I talk to, they have nice nails, nice cuticles, not too long, polished.
Plus, like a lot of jobs, like, you know, there's like regulations now.
On nails?
Well, yeah, like for us, like my girls can have like fake nails, but we have to like wash them really specifically, with Hibiclens beforehand.
Yeah, because imagine like I come in, I'm like, I got my hemoglobin thing or whatever on my face, and then you're touching me with
she's like, she like pulls out her like pointer.
That guy from like way back here.
She's like infiltrating it with the pointer, cutting off the genital wart with
Carson,
it.
Get in touch with HR and say we have a new nail policy in this office.
I have important things to discuss.
Yes.
The Salmon semen facial, I get one probably once a month at this point. I personally think it's life-changing. I know that I'm also using now, don't freak out, you have to Google it. You can talk about it. Umbilical cord exosomes. Okay. So are you, so don't roll your eyes, Michael. Can you talk about that?
Yes. Okay, this is actually going to be huge in 2025. I'm glad you bring it up. Because, okay, salmon sperm facial, what is this? It's not actual raw salmon sperm that's like getting squirted on your face.
Thank you for clarifying.
It's the extraction of an ingredient called PDRN, polydeoxyribonucleotides. And these are super energized, like DNA like building blocks for DNA, right? It just so happens that salmon sperm has the richest, purest, highest quantity of this, right? I don't think salmons are like hurt in the process, whatever. We eat them anyway.
Probably feels good.
Yeah. So exactly.
Now that is going to make a TikTok. That is absurd, Lauren.
It's probably good for them.
Salmon's like, this is my year.
Oh my God, I love it.
I'm canceling the show myself.
So that is why people find it really helpful. A salmon sperm facial is not very cheap. And I will say, do you guys get it injected in? Like micro injection?
Micro-needled.
Good.
But
you do?
I get micro-needled. But I want to try the injection.
Okay,
Why?
that's not technically approved in the US yet.
Oh,
well,
illegal.
Kind of. Not that it's illegal. It's like exosomes. It's not like FDA approved. There's no like straight up regulation on it.
But this happens in other parts of the world.
100%.
And it's approved.
Yes. Like South Korea, That's like where all this stuff comes from.
Well, I think it's important to articulate because, again, like people are gonna do what they want.
For sure.
This is not some like crazy thing that,
It's been popular in Korea for 14 years.
Yeah.
So go ahead. So you do like the injection?
I wouldn't do it for my patients right now.
Okay.
We do the facial. We have done them. I tried it because I was like on a segment for Entertainment Tonight talking about it. And this is a really good ingredient. For 2025, I do foresee companies coming out with ingredients. I see companies coming out with products with PDRN in there.
Got it.
So not that you have to go get the facial or anything that's injected in is good, but then you have those risks of like, is something contaminated? Is this actually good? Am I going to get an allergic reaction? Because that's my biggest thing. Allergic reaction and contamination for anything that's injected in that's like not like vetted, right? So that's my take on that. I think PDRN is awesome. Salmon sperm facial, if it's like microneedle in, fine, or just used as a facial, fine. I think products are going to come out with it in 2025. And this is very similar to my thoughts on exosomes, which are also not as an injectable FDA approved yet. And I think of exosome as kind of like crypto, where it's like kind of sounds amazing. It is, it could be, but it's just not like it's not like, it doesn't have like that substance regulation to it yet. So I think things are going to change. We just haven't, me personally, I haven't found like a good company or enough like research studies to like make sure it's like safe and effective for my patients. I do PRP or PRF all the time, all day long for my patients. I'm like, use their own stem cell, use their own growth factors. So exosomes, you said use as a skincare product.
I look at it like
I use Derm.
Okay.
It's a Korean brand.
They have
Okay.
PDR
And
they do.
in it. Yeah.
Oh, nice.
Yeah, I feel like you would like this brand,
Yeah.
Derm.
Nice.
There's this toner that my facialist,
Ooh.
her name is Jamie,
Yeah.
has that is one of like the most amazing products. It tightens the skin. Speaking of amazing products,
Yeah.
let's talk about what your best ingredients for 2025 are, ones that you would universally recommend.
Yeah. So I think for 2025, so one, it's like New Year's, right? What do we want to do for our skin? What do we want to do for our body? It's winter. Our skin is dry. Our skin barrier is disrupted. We want a good refresh. And there's going to be like certain ingredients that are, I think, going to be super key and super new and innovative. So that includes beta-glucans. Beta-glucans, it's a humectant, so it pulls in water in it. So what beta-glucans does is it helps hydrate the skin, kind of like hyaluronic acid does, but it goes a little bit deeper and it actually like renews the skin, calms the skin down, plumps up the skin, improves elasticity of the skin. So that's really a huge thing. So you want to look for products that have beta-glucans in it. One example is Lancome's Genefique line is really awesome. Have you heard of that one?
I love that brand.
Yeah. Really
I
great.
used that brand the other day when I was doing one of my facial massage videos.
Yeah.
It tightens the skin, it plumps it, and you can really get in there. This specific serum is a good one.
Yeah. Lancome's been around for like ages, right?
My mom used to use it. It's one of the first brands.
Exactly.
And I remember my mom using it so vividly. I feel like they know their stuff when it comes to skincare. And this particular product, that's interesting that you mention it, is definitely on my vanity at this moment.
Yeah. So it's a serum, which I love. And I think also in 2025, people are going to want to find products that are multitaskers, right? Economy is going to change. Things are going to get more expensive. We're busier. We want to minimize and we want to really look for ingredients. So that product is really nice because like each little drop, do you know each little drop of that stuff has like 90 trillion beta-glucan molecule. Like it's insane. So you see that instant plump up, which is great.
That's why I'm seeing when it like
Exactly.
my skin feels like it like almost craves
Instantly.
it. Yeah, it's that's why I like it for facial massage.
Yeah.
Like I'll like go
And then you use your little gua sha or something.
this is how I use it.
Yeah.
Ice roller.
Love.
Then I'll use like a serum like this, or I'll use an oil and I'll really get in there and manipulate my face. This is so good for plumping.
Yeah.
And then after that, I'll bring in my facial massager and I'll get in there with it. And I like how it glides against the serum.
Totally.
So what's the technology behind it?
So I think it's the fact that they know an ingredient works. They know it can get delivered to the skin, right? Because that's the biggest thing. It's like, okay, you have products that have an ingredient. Is it actually going into the skin? Is it actually doing what it needs to do? And then not only that, this product, specifically the Genefique Recovery Serum, has hyaluronic acid, which we love, and it has licorice root. Licorice root is really an interesting product because it helps brighten and it helps soothe the skin. And then for the recovery part, and this is probably why you'll see kind of the long-term benefits from it also, is it has microbiome technology. So prebiotics, probiotics.
That's why I like it.
Love it.
Because I can get dermatitis and I need that pro and prebiotic.
Exactly.
Why is hyaluronic acid so important?
So hyaluronic acid, I mean, we've known it. This is something that I think was like the last year or maybe the year before is like everyone was talking about it type of product. So hyaluronic acid, it's intrinsic in our skin. We have it. It creates like that plump, right? We lose it over time as we age. So hyaluronic acid pulls like 1,000 times its weight in water. It's nice because it plumps up the fine lines like immediately. The thing with that is you want to use it on like wet skin and then you want to like moisturize afterwards, depending on what other ingredients are there. It's very similar. Now I think the new hyaluronic acid is honestly like beta glucans because beta glucans does a little bit more. It renews the skin. It helps brighten. There's studies behind it, which there are for hyaluronic acid too. But I think in this case, you want to, in 2025, if you want to find a right product, you want to look at your skin concerns. You want to know your skin type. You want to look at your skin concerns. And then you want to find ingredients for that and then find a product that has those ingredients that has been around for a really long time.
And what about licorice root? What exactly does it do?
So it helps brighten. It's like it's lighter, so it's not going to irritate your skin. It's one of those like integrative, like holistic type ingredients that I recommend for my patients. And it also is really soothing.
And is this something that you can take these ingredients down to the chest? Because I like to take it to the tits.
Oh, yes.
So you can take it all over the neck?
You can. Yeah. That's a really good point too, because I think our skin on our neck is so thin. It's like 10, I don't know. It's not 10 times. Our eyelids are 10 times thinner. I don't know how thinner our neck is, but it definitely is thinner. And that's why we see the signs of aging there. And then of course we always miss like the décolleté and neck and chest area. So you absolutely could. And because it's a serum, a little bit kind of goes a long way. It kind of like drips all over.
Do you know how important it is to bring your skincare down to your nipples?
I bring it down. Because I read so much and I'm always like this. So I'm trying to.
Yeah, the tech neck.
Well, I got these glasses. My friend Kata gave them to me. So I don't have to look down at my phone anymore. Wow. The glasses reflect, so I don't have to move my neck.
Okay.
So I look like Ichabod Crane when I'm looking at my phone, but I'm not looking at my phone. So everyone when I Zoom with gets mad because they think I'm not looking, but I am looking. It's just a reflection.
You have to send me those.
It's ridiculous. It looks like
you have to send me those.
It like has multiple angles to the glasses.
If I'm going to use my hyaluronic and my licorice root and my beta glucans, then I am going to let that stuff sit in and I'm not going to be moving my neck up and down. I don't want tech neck.
Totally. There are things that we can do for tech neck, but yeah, all this stuff costs money. So why go through that?
What are some other little tiny tweaks that you would make to people's skincare routine that are easy and efficient and quick?
So let's see. I think that number one, if they do come to my office, I want to make sure that I look at their skin as a whole. Do they have rosacea? Because their skin and what ingredients they need for their skin is going to be different with someone that doesn't have rosacea or doesn't have acne. Do they have oily skin? Do they have combo skin? Do they have dry skin? So that's going to be, I think, a big thing is like know your skin type.
Is it mostly genetics that play into that, or is it genetics combination with diet and lifestyle?
That's a good question. I think genetics is huge. I think where you live is huge too. Like it's way more humid here than like the desert, like where I live in Tucson, and then also in LA.
I liked it when it was out there. It was like dry. But
oh
I
yeah,
guess
my
it's
hair
not the
was
best for skin, right?
It's so dry. Like everyone has eczema there. Everyone has like some type of dermatitis. Like perioral derm is like rampant there. I feel like because just everyone's skin barrier is so compromised.
I visited out there and I had 10 humidifiers in my room.
Yeah.
I don't, you have to have 20 humidifiers.
You really do.
You get used to it though, a little bit.
Yeah. I like it.
You do.
I love it.
Yeah, I liked it when I was out there. It's been a bigger adjustment me coming out here with the humidity.
Yeah.
I guess some people say it's good for the skin.
Yeah.
But
The thing with dehydrated skin is you just look older. So people come in and they're like, I just look and feel so old. And then I'm like, your skin's just dehydrated. Let's hydrate you up.
That makes sense. So you need a humidifier.
yeah, but when I was
What
there,
are other little tweaks that we can do?
Let's see. So I think in 2025, people are gonna, I think, dibble dabble with cosmetic treatments a little bit too. I think they're gonna be careful about who they're going to a little bit more. I think this year filler was vilified, and I think in 2025 maybe they're gonna try it again. Maybe this year they got it dissolved. Next year they're kind of get in there again a little bit.
Okay.
I think lasers are gonna be huge. I think lasers are like that one X factor where if you know, and your skin looks so much better if you're getting some type of laser to help resurface, help tighten.
Like, give us some examples of names.
Okay, so I think as just to start, if someone hasn't done anything before, like Clear and Brilliant is nice. A cool peel is so great. So these are things that resurface the skin, so helps with like fine lines, large pores, things like that. I'm a huge advocate for energy-based devices that tighten the skin, like radio frequency microneedling, like Morpheus. I know this was like a huge thing where everyone was like, oh, but it melts fat, it disrupts your skin, da 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 da. But I think it just got so big and popular that it got in the wrong people went to people who didn't know how to use it.
you know,
like
you were
with
talking
anything.
earlier about some of the stuff with the micro needling and some of those practices, and I look at it the same way I look at Botox or a tattoo artist. And it's like some of these people that are on the cutting edge of this technology that have done the most research and taken the time to become professional practitioners of this kind of new technology they're few and far between. Like there's a rarer people. I think you have to be careful when these things become mainstream and everyone starts doing it.
Totally.
And I think that's why these practices get a bad name. Even like the exosome PR, was it PD?
Yeah. PDRN, yeah.
PDRN, like I agree with you. You have to be very careful as things get more popular and you have everybody that doesn't have the know-how jumping in and doing it to people, that you could have dangerous practices.
You'll get like fake stuff because this stuff's expensive.
But same thing happened with like filler, right? And
totally.
same thing happened with Botox.
Yeah.
And I just think people, even when they hear podcasts like this, I want to caveat them and disclaim that Lauren and I are fortunate that we spend a lot of time making sure we're going to people that are well vetted and professional, have like really built upon their skill set to be able to do these things properly. We would be the first people to say like we would not go to anybody that does not know their shit.
100%. And I think that's why you guys have brought people here that are really knowledgeable. And I think that people really should just know their provider, know who they're going to. And unfortunately, the better providers are more expensive, right? So I just say, don't cheat yourself out on this. You don't need filler all the time. Also, like, the people are like, I don't want filler because it doesn't 100% go away. That's not a bad thing. Like, if you have good filler, you want it to stay there as long as you can, you know?
My perspective on like it being more expensive is I would rather pay the expensive rate and get it right as opposed to paying a cheap rate and getting it wrong. And I know that sounds like something privileged to say, as obviously somebody who's, I have financial means, but I would almost forego the service completely if it's going to be with somebody who doesn't know what they're doing, with a risky service provider that's not vetted and not doing best practices, because like you can have way more problems that end up costing you way more in the long run.
It does. Like when I see a lot of patients that come in and they got overfilled somewhere and we're kind of starting over, it does cost a lot of money and time to take off work, blah, 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 to dissolve it off and then restart again. It ends up being more. But I never want to like shame anyone for, sometimes they don't know. They'll go to like a random med spa down the road, whatever, and they don't know what they're getting into. And I think it just, we learn from it. And I think people are so knowledgeable now about speaking up for themselves and being their own advocate for a lot of these things. For health especially, I think is so important, but also like cosmetics.
Out of everything I've ever tried and done, think that the two best things that I've done for my skin are facial manipulation mixed with good skincare. If someone's listening and they want to start with 3 products for great skin, what are the 3 products that you're recommending?
Okay. I'm going to do ingredients. Does that work?
Yeah.
Okay. So I would say if you're just starting off, you have like no base at all. I would say you need to be on some type of retinol. I know that's controversial. Not everyone's on a retinol. Not everyone can tolerate a retinol, specific retinols. But I think that most everyone, like you're on a retinol, but your skin's like not irritated. So I think that a retinoid, and retinol being the over-the-counter version, is truly the gold standard. And I had Shawnee Darden on a while ago, and we were just like fangirling over like retinol. And I'm like, it's because we know like what it can do to the skin. And it truly is the one huge anti-aging ingredient. So I would say find yourself a product that you can tolerate that has retinol in it. Okay, that's number 1. And then number 2, it's like SPF. Yes, you don't have to like put yourself all throughout your body, head to toe, in sunscreen. I think there's other ways to sun protect. Like I don't like putting my whole body and like rubbing myself with sunscreen. I will do my face, but like other areas, I'll wear a hat, I'll wear a long sleeve if I'm out, things like that. But I think a good SPF is good. If anyone's listening and they're at all worried about SPF or their ingredients, go with the mineral, go with non-nano. They're all safe, but there are all different types of SPF that perhaps are less chemical.
I have to give you a Skinny Confidential SPF. It's mineral.
Okay.
And it's caffeinated.
Oh, I love that.
So it tightens the skin.
Yeah.
While it's protecting.
Ooh.
And it's got the prettiest tint.
I love that.
I have to give you some before you leave.
I bet it's really nice under the eyes.
It's
too.
so nice.
Like
I'm
helps with dark
obsessed with it. I
circles
use
and
it
stuff.
every single day under my makeup.
Oh, I love.
And
love,
what's
love.
the third one? The third one's got to be the best one.
And then 3, it's all about the skin barrier. It's all about skin hydration and fine lines. And that's finding a multitasker, whether that's beta glucans, hyaluronic acid, microbiome. And that product would be Lancome's Genefique.
You love this product so much. You gave us a code for the audience to shop. You guys can go to Lancome-USA.com and use code TSC20. You get 20% off. The one that we like specifically is the Genefique Ultimate. That's the one that has all the ingredients in it. I like to use it for facial massage. I've heard about this product for the last year from so many different people, off air, on air.
Is this one mine? No.
You can actually have that one because I have 3 bottles at the house.
All right. And I would use
if
this.
it's okay with Dr. Sheila, can you steal that?
I would use it after.
I love that. Okay, it's a serum, right?
Okay,
so you want to go thinnest to thickest. So you want to cleanse first, and then that, and then your SPF, like somewhat cream afterwards.
Okay.
Yeah, if needed, but SPF usually.
And I really wish you would start doing facial massage with me because you can give yourself a brow lift with it.
Listen, I'm coming to Tucson.
Yes.
I graduated and everybody goes back for these like reunions.
Mm-hmm.
But I was like, I'm out of here.
I'm too cool.
I never went back. I just feel like I did it. You know, it's like I'm back in the reunion.
You didn't want the whole school to see you looking like Woogie with that shit on your face from something about Mary.
I feel like it's been now.
That's what he's acting like.
Has it been?
He's acting like he has open sores all over his face. It's a fucking
It's been at
dot.
least 15 years, 10, 15 years. Now I'm going to come back to Tucson. We're going to hit some lasers.
Yeah.
We're going to get this thing off my face.
Yeah, we'll go to that one bar that you were talking about.
Well, not dirtbags. We're gonna go like Bashful Bandit.
I don't know
Moon.
what you're talking about, Michael.
I don't know if all these places even exist anymore.
I don't know. I feel like they like are turned over like this.
And Dr. Sheila has her own podcast. It's on Dear Media. It's called Derm Approved. What can our audience learn from your podcast? What are some guests that you've had on? What are you proud of?
Yeah, so I love it because it's backed by you guys. I'm a dermatologist, so it is all things skincare, cosmetics, and skin, hair, and nail wellness, right? And I have some solo episodes where I dive into the details of just all the info. I answer questions. My last solo, I talked about stretch marks, cellulite, KP, body acne, hyperpigmentation, like so many things. And I've had some great guests. So we've had like Shawnee Darden, I had Dr. Pimple Popper on. I've done some swaps with other Dear Media girlies. And it's just been so much fun.
Dr. Pimple Popper, does she like to pop pimples?
No. And it's so funny because we did a reel and it's on the Dear Media page and it says like, we don't recommend squeezing pimples. I think it really kind of depends. But Sandra Lee, she is amazing. So nice. It was such a good time. And it was like really a good episode because it was on acne and acne scarring.
I've never been a girlfriend that's like, lay down, let me pop your pimples.
No,
Like that's just never been me.
No, good. And that's like, honestly, it's like makes them worse.
I have this theory.
Now imagine if you had those
You
long...
can tell me if I'm wrong or not.
Yeah.
I have a theory that when you pop a pimple and one speck of that bacteria juice gets in the other area, another pimple forms.
No, you're so right. And not only that, but on
That
an
was my
inner,
intuition.
like internally, it creates like
Uh-huh.
like a inflammatory cascade where
So
you get
pop
more.
the pimple and then it drops somewhere else
Yeah.
and then you get another pimple.
The only
Just leave them
time,
alone?
the only time that I say it's okay to pop a
The
pimple,
Lancet.
the Lancet, when it's a whitehead. It is almost on its way. You heat it with a little warm, right after the shower. It's soft. It's warm. You can almost like just wipe it off, right?
Should I come work at your clinic?
Yes. Oh my God.
I think that I like maybe.
You're like a derm.
All right, I'm coming to see you. You know why? I went and I was looking around and I'm like, I don't know, this guy's nice, but I need somebody that I can trust with a laser.
There you go.
And then he was up your balls looking at if you have any moles up there. I
Oh,
can confirm you have no moles.
okay, good. We'll get you down there more
No,
often.
Yeah, your skin
I'm
check,
good actually
people.
after last night.
Yeah.
Okay. Where can everyone find you, follow you, pimp yourself out?
So the podcast, Derm Approved podcast, I have an IG for that. And then my main social handle is Dr. Sheila Derm. I'm super active on there. It's on Instagram, it's on TikTok, and then on YouTube. And I'm just spreading all the knowledge.
I love it.
Yeah.
Thank you so much
Thank
for
you, Dr.
coming on
Sheila.
the show.
Of course. Thanks for having
I
me.
have notes. I'm inspired.
Amazing.
Thank you.